Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's tip is again another question answered from one of our members. We have a membership for families of critically ill patients in intensive care at intensivecarehotline.com if you click on the membership section or if you go to intensivecaresupport.org directly. So let's read out another question from one of our members who says, "Hi Patrick and team. My husband tried the bolus feeds method today. Prior to that, he had a bit of diarrhea. The night nurse deliberately allowed a lot of air to go into the tube and didn't use warm water to flush it. The dietitian was trying to discourage me from doing the bolus feeds and printed a long list of disadvantages. I think they deliberately planned this to happen. My husband's oxygen level went down rapidly, although it came back to 80 to 90. But they did his ABG, I think it was in the 40s, and they transferred him back to the ICU. And he's now back on the ventilator with the trach. We are planning on going home, and they kept dragging their feet, finding excuses. If this had happened at home, I would have transferred him back to a hospital I'm more comfortable with. I will seek to transfer him to a different hospital ICU." So this is a client who's had their husband in ICU for quite some time with the ventilator, tracheostomy. Now she's thinking of going home. Problem is that the client is in the US, and we don't have intensive care at home services in the US yet, unfortunately. So, going home for her will be a challenge, but let's look at our response. Obviously, we're not mentioning names here. We're keeping, we're protecting the identity of our clients, but thank you so much for your email. I hope you're all well, and thank you for the updates. Regarding your husband's diarrhea, may I know why the DIA and when the diarrhea started? Right after the bolus feeds, and what about the feeds or formula? Was the formula new or first time to introduce that kind of feed, or the same feeds he has been receiving every day? May I know the type of milk? Most renal formula make the stool semi-loose and not formed in character. Are you sure that the milk given is properly stored? Observe the diarrhea for how many days he has been having diarrhea. His diarrhea may be due to other causes, perhaps secretions, spoiled milk, infections, virus, food allergy, food intolerance, reaction to medicines, antibiotics in particular. Anyway, here are the advantages of bolus feeds over continuous drip feeding. Bolus feeding is similar to a normal feeding pattern, more convenient, less expensive, and allows freedom of movement for the patient. Patients with feeding tubes who can tolerate normal amounts of feed can be fed and try bolus feeding. Most of our pediatric patients are on bolus feeds every 3 hours. Very sick children with disorders in the stomach, breathing, days of recovery from operative procedures, etc. And other disease conditions are fed by continuous method or using the feeding pump. Fully awake, patients recovering well tried the bolus method since the bolus method is similar to a normal feeding pattern, usually given every 4 to 6 hours. Frequency in adults also depends on every patient's feeding tolerance. The disadvantages of bolus feedings are they are easily aspirated, especially when fed the wrong way, meaning not in the proper position. Feeding while lying flat on the bed. The feeding position is to keep the patient in a sitting or semi-sitting position. The head is elevated or higher than the abdomen, so the food content will not go upward to the lungs, leading to aspirations. May also cause bloating, cramping, nausea, and vomiting, especially when you are feeding the patient with a large amount of feeds. The amount of feeds must be given as per patient tolerance. That's why the feeding is not given in abruptly large amounts. You can increase the feeds every other feed or as tolerated. For example, you feed your husband at 9 a.m. with 50 mils of milk, then at 12 a.m. you will feed him with another 50 mils of milk again. When he tolerated the 50 mils twice, no vomiting, no nausea, no difficulty of breathing, no bloating of abdomen noted, etc. Then at 3 p.m. you can increase the amount to 60 or 70 mils and then observe his tolerance. The increment in the amount of feeds every 3 or 4 hours feeding interval can be increased accordingly. Always flush the feeding tube with warm or drinking water after feeding to avoid tube obstruction or clogging. Then allow Charles to remain in a semi-sitting or sitting position after feeding. Don't put Charles back in a lying position because there is a risk of aspirations. If aspirations happen, his oxygen saturation will drop, decrease. He will have breathing difficulty, abdominal discomfort, nausea, vomiting, etc. Always clear the respiratory secretions prior to feeding and always put your husband in the correct feeding position, sitting or semi-sitting positions. What was the ABG result? Have they taken the chest x-ray? If aspiration of feed content happens, the doctor will see in the chest X-ray, see it in the chest X-ray film, and they have to keep him off from feeds or hold off the feedings for now. Is your husband back in ICU and on a ventilator? Did the doctor explain to you and update you on what caused him to be back in ICU and the ventilator? Any signs or new infections? What are his blood results, arterial blood gas results in particular? What are his ventilator settings? How often does he need suctioning, right? Have they changed the inner cannula? Does he need a tracheostomy tube change? Those are the questions you should be looking for. Since your husband is back on a ventilator now, there must be a breathing problem. The doctors might return or resume feeding by pump or continuous feeding method. You can always ask the doctor to update you and explain to you the plan of care for your husband, and of course get access to medical records urgently. I also hope that your husband is fully conscious, cooperative, and not having cyanosis or discoloration of the lips, like color violet or gray. You mentioned that oxygen saturation is 80 to 90%. It is low. He needs more oxygen and clearance of the airway. The tracheostomy tube might have secretions or obstructions. So have the respiratory therapist suction and clear Charles' airway, your husband's airway, for good breathing and ventilation. You said 4D, is that from the blood gas results? Is it PCO2 or carbon dioxide? If it is PCO2, it is within the normal range. What do you mean by 4D? If it's PO2, oxygen in the blood gas, then it's too low. Again, it comes back to that the biggest challenge for families in intensive care, simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. The devil is in the detail in intensive care. You know, people always come to me and they say, oh, my husband is on the ventilator and he's on 4D. What does that even mean? You know, and you know, when someone is on a ventilator, there's dozens of numbers on a ventilator screen, and you need to understand all of them in order to make informed decisions, you know, have peace of mind, control, power, and influence. You can't just keep throwing numbers around, because there's many numbers that need to be looked up. So anyway, with you going home, or with you wanting to go home, you know, we have discussed this on the phone, that it'll be very, very challenging for you to go home by yourself with a tracheostomy and a nasogastric tube. You know, it'll be very, very challenging. Unfortunately, you're not in Australia. For those of you watching who are in Australia, you know, we're providing intensive care at home nursing in Australia, where we send critical care nurses into the home for patients with ventilation, tracheostomy, nasogastric tubes, PEG tubes, you know, anybody that's medically complex and would be in ICU long term. We're looking after them at home. And this client here in particular is struggling getting their husband home, because there are no services in the US that can provide a similar level of high quality care, you know. And if you are watching this and you are in Australia, where NDIS, TAC, iCare, NIISQ, and DVA approved service provider, so please contact us if you need help there. But even if you're in the US, reach out to us. We can help you with consulting. We can help you with advocacy. You know, we can help you, you know, potentially finding other service providers in the US. We have a network, so please reach out to us. In any case, if you want your questions answered and you want to become a member of our membership for families of critically ill patients in intensive care, please go to intensivecarehotline.com, click on our membership link, or go to intensivecaresupport.org directly. Also, in the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. Now, I also offer one-on-one consulting and advocacy for families in intensive care over the phone, via Zoom, via Skype, via WhatsApp, whichever medium works best for you. And I talk to doctors and nurses directly. I talk to you and your families and help you with making sure you can make informed decisions, have peace of mind, control, power, and influence, because I ask all the questions that you haven't even considered asking the intensive care team. Again, you don't know what you don't know. I also represent you in family meetings with intensive care teams. I have helped hundreds of families in intensive care all over the world to make informed decisions, have peace of mind, control, power, and influence. I'm not exaggerating when I'm saying we have saved some lives, and you can verify that on our testimonial section. You can verify that with our case studies. You can verify that with some client interviews we have done on our podcast. We also offer medical record reviews in real time so that you can have a second opinion in real time. And we also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Now, if you like for families in intensive care, click the like button, click the notification bell, comment, share the video with your friends and families, and intensivecare.hotline.com and